All right. Hello, everyone. To all who are new here, my name is Dr. Melissa Nicoletti, and I would like to welcome you all to Releve Sports Medicine's virtual journal club. So just going to go over a little bit of information, and then we'll get to our talk. Okay, so for additional webinar educational opportunities, you can visit our website and register directly for the webinar or sign up for the email list to be notified of upcoming webinars. We're continually updating our schedule, so you can obviously check back often. The video will be available after this journal club. The information contained in the video content represents the views and opinions of the presenters and does not necessarily represent the views or opinions of Releve Sports Medicine. The mere appearance of video content on the website does not constitute an endorsement by RSM or its affiliates of such video content. The video content has been made available for information and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional and medical advice or delay in seeking it because of something you have read or seen on this site. Releve Sports Medicine hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly, or indirectly from any use of the video content, which is provided as is and without warranties. We are looking for an athletic trainer to join our team. This is a full-time clinic-based position working in a sports medicine clinic. Please feel free to pass our information along if you know of a qualified candidate. More information regarding applying can be found on our website. For all athletic trainers who are attending to get live CEUs from the BOC, you'll receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive a follow-up email or you have any other questions or concerns, contact us via email at journalclub@relevesportsmedicine.com. Once the statement of credit is available for download from our website, you'll receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, just swipe the screen to the left and the slides will become visible. The recording will be available for review from our website tomorrow. Okay. All right. Give me 1 minute here. Okay, so now I'm excited to introduce Dr. Kelly Ryan. Dr. Kelly Ryan is the current medical director of the Horsemen Health Program. She is also a sports medicine faculty member for the family medicine residents at Medstar Franklin Square Medical Center. She received her Doctorate of Osteopathic Medicine from Philadelphia College of Osteopathic Medicine. She is the head physician for the jockeys and backstretch workers at the Maryland Racetrack. Dr. Kelly Ryan was born and raised in Baltimore and is a proud resident of her hometown, Charm City. I'm super excited to hear her talk. I am going to turn it over to her. And again, if you have any questions, feel free to ask them in the chat and I will be keeping my eye out on that. All right. All right, Dr.
Okay.
Ryan.
You forgot to mention how we were best friends.
Yeah, that too, I did.
Hi, everybody. Can you see my screen now?
I can see it. I just want to make sure. I believe so. Yep.
Okay, perfect. Welcome, everybody. I am very excited. Thanks so much for the invitation, Melissa, Dr. Nicoletti, because I think that my job is pretty cool. And I don't think that there's a lot of people out there who really can appreciate or understand the world of racetrack medicine. myself included when I first started. I do think that there is a very large role that athletic trainers could play at the racetracks. And so will be my dream to see athletic trainers more at the racetrack, but we do actually have a couple racetracks that have athletic trainers on the tracks for riding and to be there to help with injury management. And Kentucky is one of them, woo woo, Norton Health. And then also Delaware Park. They also have an excellent premier PT athletic trainers that I've been fortunate enough to work with. So I think that overall there really is a lack of medical care for humans at the racetracks. There is a lot of vets and there is a lot of concentration on horse medicine, but not so much for jockeys. So I'm going to tell you a little bit about my story here. I have no disclosures. These are some of my patients. I always say that I like taking care of jockeys because when you go and try to do a Lockman on a much larger person, it can be a little bit difficult, but examining jockeys is very easy, much easier than most other athletes. So we do have some objectives today to discuss basic training, weight requirements, and common injuries in professional jockeys, to discuss the gaps in knowledge of concussion management and importance of further developing return to ride protocols, and to evaluate the benefits and unique opportunity of having a sports medicine model implemented at the racetracks. So a little bit about me. You guys probably already heard a little bit about me. I was fellowship trained in sports medicine. And so, you know, in your fellowship, you get a lot of concussion management. You're able to learn more about, you know, on the field management of injuries. We do a million pre-participation evaluations, talk a lot about orthopedic injuries. I also am a sports medicine faculty. After I did my fellowship, I came back to where I did my residency, which is really nice for me. I will probably never leave Baltimore ever. And I also am one of the team physicians for the Baltimore Orioles, and I also work with a Division I college. So I have a wide variety of things that I do. And then my racetrack position actually started because after my fellowship, I needed a job and they were looking for a doctor, and it was literally the only way that I would be able to stay with the group that I was with was if I accepted this job. And at the time I was like, you don't need a sports medicine doctor, like you need like a trauma surgeon on site. So when you first finish training, you're a little bit hesitant to even do anything like prescribe amoxicillin for strep throat or do anything. You forget everything that you've learned because you're just panic stricken that you're on your own. And then they decide to put me at the racetrack, which I was, of course, extremely concerned about. So, you know, to kind of learn a little bit about, oh no, my slide, sorry. Oh, there it is. So, you know, I was thinking I don't really know pretty much anything about horse racing. I know that I used to go sometimes when my dad and my dad's boss were in town. They liked to go to the racetrack and we would pick like the gray horse or we would pick a number. But I really didn't know anything about jockeys specifically. I did know a lot about sports medicine from my fellowship training, but very little about jockeys. So what I did was I ended up going to the web. If you didn't know, on Animal Planet, they actually had a jockeys reality TV series.
You feel empty. You feel desperate, thinking, you know, maybe we can do something. Maybe he just turn it back on. But it was definitely an empty feeling coming down the stretch. They coming to the top of the life.
So they're actually, like I said, is a reality TV series called The Jockeys. So believe it or not, that's where I learned a lot about what I knew about jockeys, because it goes through a lot of their life and, you know, exactly what they do and what their training is like, what the pressures are like. And I found it to be very helpful. It's a funny story now is that the guy who you actually saw in that video actually works at the racetrack that I work at. And I was almost like starstruck because I was like, oh my gosh, this is where I learned about jockeys from. So actually television can sometimes be helpful because to be honest with you, there really wasn't that information in terms of journals or medical literature on jockeys. So you just kind of have to figure out what you find the information that you can wherever you can. So I do also find Mike Smith, one of my most favorite jockeys. I hold him dear to my heart because I also associate him with a lot of the things I learned about Jockey. So every time that he comes to the Preakness or he comes to anywhere where I am, I always get, again, a little bit starstruck. So what I want to show you is this is just an example of one of the races. We're going to kind of go through, the day at the life, a day in the life at the racetrack. But I just kind of wanted to give you a little bit more of a better perspective of exactly what kind of sport we're talking about. So here you can see the starting gate. The jockeys are in here on the horses, and we'll go a little bit more. So when they first are loading up the horses, they actually are getting into this small area with the horses. It's a 1,200-pound animal. So this actually is a big risk of injuries because you can get hit in the gate. They can get their foot pinned. They can get their hand pinned. As they're coming out of the gate, they could hit their hand. And then they go ahead and they take off. Right now, they're just kind of in what we call a martini glass position, where they're just using their legs almost as like suspension. Some of them are actually pulling back on the horse because the horses are going so fast that they kind of have to pull them back to keep them from running too fast. This can actually be pretty difficult, and it takes a lot of strength to be able to do this, although they're very small. They're very mighty. So then they come around. You can see the rail on the left-hand side. You can see how close they get to it. Some of the rails actually break away just in case there is a fall. You can tell that the jockeys are actually pretty close together. I find this to be completely terrifying. This actually is a helmet cam on one of the jockeys that we take care of. But you can see how they kind of get their placement. They're still holding the kind of that martini glass position where they're not necessarily actively pushing too much. They're still kind of just letting the horse do most of its work. You can see that there is a racing crop in the right hand of the rider over here on the number 8 horse. Again, sometimes they mostly just hold the rein. Believe it or not, a lot of times they'll actually hold onto the mane of the horse, but they kind of just go with the horse. Again, being able to use that suspension and kind of that like shock absorbing like legs really helps. This is when it gets a little bit scary because it's a very, very close proximity to the other horses. One small like error could result in the horse's legs getting tangled, which is called clipping heels, and that can be really dangerous because once a horse goes down, there's all those horses behind them. Now you can see that they're starting to use their racing crop. They're kind of crouching down a little bit lower. They're trying to get some of that air resistance, and you'll see that they're actually pushing the horses. This helps them to kind of get ahead. Some of the rules have been changing recently about using the racing crop as a matter because there was some problems with some horse breaks down, which is when, unfortunately, when the horse has a really bad accident and something really bad happens to him. So they start to look at, is this cruelty to the animal and all these other concerns, which, to be honest, if you go to a racetrack and you talk to the trainers and the owners, they love those horses to death. And horse people are a very special breed, pun intended. So another clip I just wanted to share with you. Take a look here, which one this was. I love looking at some of these races.
Directly in behind the horse with the pink silks, maximum secured. Now he has a lane to run, so his
So this is a controversial ride here. This is actually the Kentucky Derby.
Right there
you can see how the horse actually crosses over, but again, this is another good view of how many horses can be on the track at one time and how dangerous can be. This actually is considered a safety rail, which is designed in case the jockey falls off onto the rail, they won't necessarily get as hurt, because obviously I'm sure you can imagine that it's very dangerous. But that was the Kentucky Derby where one of the horses actually got taken down, and the second place winner actually ended up winning. So I was covering this race actually.
As soon as they open the gates, right there, and it's almost like a fucking bronc at that part. And John Velasquez, there was no way that he could possibly hang on with the start like that. So now Bodie Express is running loose off to the far left. Fortunately, he didn't interfere greatly.
So you can't really see me in this clip, but I'm actually like running down this way because I knew that the jockey had a fall, and you never really know what you're going, what to expect when these types of things happen. because sometimes they can fall off of a horse and be perfectly fine. I've seen people, you know, almost get near trampled and be perfectly fine. And then you also have people who just get tossed off of the horse and have fractures or concussions or really bad injuries. So it's really hard to predict, you know, which one of these falls is actually going to turn out to be an injury. I like to say that the sports medicine doctors at the racetrack, or what we call a racetrack physician, is actually like the ultimate physician, because we do a lot of sports medicine. There's a lot of emergency medicine. There's a lot of urgent care for horse bites. Believe it or not, I've seen multiple horse bites in the past couple of weeks. There's a lot of mental health. There's people who actually live at the racetrack to take care of the horses. Unfortunately, you know, they live in almost a poverty state. Some of them will actually live there in what is almost like dormitories to help to stay there and to take care of the horses. They come from other countries. There's a lot of alcoholism in the backside. There's a lot of pain medications that the people are taking, a lot of drugs. We have had some really bad incidents, unfortunately, in multiple racetracks due to drug use and mental health use and those types of things. Occupational medicine, public health, and then preventive health. A lot of this, you know, creating emergency action protocols and preparing for that. If anyone has any more interest in sports medicine at the racetrack or anything like that, you actually can. I kind of wrote this article almost to be a manual for people who wanted to work at the track or started to start, because when I first got there, we really didn't have that much information. There was some information that the UK had come up with, or Ireland has done a really excellent job of publishing on jockey health, but there's not really great information. This article kind of gives an overview of pretty much everything that you need to know in order to cover, just kind of like goes through what kind, you know, tells you about the athlete and those types of things. So what is the sport? The sport actually started way back in 1665. I'm pretty sure it's one of the oldest sports out there. In Maryland, the Maryland Jockey Club was actually founded in 1743. Pimlico was built in 1868 and is actually the third oldest racetrack in the United States. And that is where the Preakness is held. The Preakness is one of the Triple Crown races. We're this, what we call the second jewel. And it is a good time because it's 150,000 people getting together because they love horse racing. Horse racing, unfortunately, is kind of a little bit of a dying breed, except for that you can bet online. So that's kind of why it still exists, is because of people betting online. It's not too many people come out to the racetrack. Now, if you live in a place like Kentucky, of course, there's always going to be, it's going to be packed. And Saratoga is a beautiful racetrack that has a lot of, you know, has a lot of people who come from all over the country to go there. The races are set in distance called furlongs, and that changes with each specific race. There are tracks all over the United States. The largest horse race actually occurs in Dubai. It's the richest race of the year. It's really interesting to kind of watch some of these races. You'd be surprised, but there are probably horse racing happening every single day. In Maryland, we race 3 to 4 days a week, every single weekend of the year. So it is a lot of dates. The racetrack is either made of dirt, or they also have turf races, depending on you know, if you can maintain good grass. The horses like to race on different surfaces. So some horses are really kind of like to run on the dirt, and some like to run on the turf. So you kind of like stick to what you're good at, kind of like almost like runners. And they actually have to change the horseshoes if they change surfaces, similar to like cleats, which I always find to be fascinating, you know, from a sports medicine standpoint. So one of the other problems is that jockeys actually are typically approximately 116 pounds. They can race up to 120, including the equipment. For a full-grown man, that's actually pretty low, and it hasn't really changed like the rest of the United States has changed in their weights, which is kind of one of the difficult things that we're continuing to push forward and try to advocate for. Is maybe a more healthy weight for a jockey, because the jockey weight management can be really difficult for them. It can put a lot of stress on them, and it's very difficult to maintain that. You also have to consider bone health, and we'll talk a little bit about that later. You start out as a bug boy or girl. You can start as early as age 16. When you're a new jockey, you actually get an allowance of up to 10 pounds. So that way trainers want to put you on their horses. And so it gives you a little bit of an advantage. And then once you start winning more, they take some of that advantage off. And then once you're done your first year, then you have to race the same weight that everyone else does. Now, let's say that you're a little bit lighter than everybody else. They'll actually add weights to the saddle, or they'll use a heavier saddle So that way it's kind of same across the board. Different horses can carry different weights depending on whether or not they're older. And so that's all just some interesting fun facts, not necessarily sports related, but it's important to know about your athletes to kind of know where they're coming from, so you know what their stressors are, so you can meet them where they're at. One of the other most dangerous jobs at the racetrack is actually what we call the gate crew. Besides the jockey and the horse in the gate in that very small area, there's actually people who are called the assistant starters. They actually hold the horse to make sure that they're not acting up. I have seen some really terrible problems when the horse will actually rear up in the gate and almost pins the jockey. If it wasn't for the assistant starter, one of our jockeys would have been completely crushed. And who knows when that horse starts flailing, in terror because they're in a small area, what could have possibly happened to that jockey. So I'm very thankful for them. They do an excellent job, and they also wear protective equipment. Other people that are at the racetrack which help with racing are the backstretch employees. So you have hot walkers that actually walk the horse. You have trainers who help to train the horse. You have grooms that help to clean and wash them. And they are some of the hardest working people that you'll ever meet. They usually start at very early in the morning, start at 4 to 5 a.m. The jockeys will get there and exercise riders will get there to help to work the horses in the morning. But ultimately, a lot of people think that the horses are the real athletes. They're almost basically running on their fingers if you think about their anatomy, which is also fascinating as a sports medicine doctor, to talk to the vets and hear about different sports medicine injuries that the jockeys have. They have huge sports medicine facilities for horses, and again, very little care for jockeys. The horses are not allowed to race until they're 2 years old. And just another fun, interesting fact is that the Triple Crown races are actually only raced at 3 years old. So you only get one chance to kind of make that Triple Crown. The stewards are almost like the referees of the racetrack. So sometimes, like in that one video that I showed you in Kentucky, what happened was the horse had come over in front of the other horses and it was considered to be dangerous riding. So actually, unfortunately, that person got taken down. That doesn't happen too frequently, but it's the referees. It's the steward's job to make sure that the jockeys are riding safely. And if they do have concerns about the safety of the riders, or them putting another rider in risk of falls or something like that, or dangerous riding, then they actually sometimes will get days suspended, or they might even have a fine. So there's a lot of money in horse racing. I find this to be, kind of upsetting because all I ever hear is there's not enough money for this. Why can't we have an athletic trainer at the racetracks for training or during race times? Because to be honest with you, a lot of times there's not even anyone except for EMS on the track. So, I'm always told that, oh, there's not enough money, but there is a lot of money at the tracks. I mean, it's like $1 billion industry. So the purses are actually paid by the track. Now, here is another really fun, interesting fact is that 60% of the purse ends up going to the winner, and then 10% of that ends up going to the jockey. So essentially, a jockey makes 6% of whatever the purse is. Sometimes the purses are $30,000, sometimes they're $100,000, sometimes they're $1 million. So depending on if a jockey wins that race, they can actually make a significant amount of money in just one race. And then if you think about it, if they win more than one race in a day, or if they win multiple races in a week, then that is pretty good money. But there are some jockeys that'll go weeks without winning any races. It's kind of almost like a kill what you eat type of atmosphere out there, and it's actually really difficult for them because they'll show up and train horses and will exercise horses for some of the trainers in the hopes that the trainer will put them on their horse later on. However, sometimes they don't necessarily do that. So the jockeys help and don't actually get paid for morning work, but then they don't get put on the horses in the afternoons, and that can be really disheartening. Mentally, again, it's really difficult. Those jockeys obviously struggle, and I don't blame them whatsoever. I feel terrible for them sometimes, to be honest with you. A jockey will also sometimes get anywhere between $60 and $100 just for a mount, and some jockeys will race anywhere from 1 to 12 mounts a day. So sometimes you can even just make a living just making your mounts without actually even winning. If you think about it, you race 4 or 5 horses, you can get $400 to $500 in just a day, even without winning a race. So again, it can be very lucrative. However, that's only if you're one of the top jockeys. Not many jockeys make it through the first year of their riding because sometimes it's just too hard for them. Also, injuries often will cause them to be finish their riding career. So in the training, like I said, they wake up in the morning. The horses are groomed by the grooms, and they get walked and they get fed. We'll see a lot of allergies because there's a lot of straw. There's people have allergies to the horses, so it's a lot of asthma, a lot of respiratory issues and things like that. Jockeys actually will work horses very early in the morning. Sometimes they'll take a nap, and then sometimes even after they go to one track, they'll actually travel to another track and race in the evenings. Our track doesn't have lights, but some of the other ones like Charlestown does. So they're enough close proximity that they can go to multiple tracks a day. I had one jockey who told me that I think he went to 4 tracks in a day, but that sounds crazy. But anywhere, at least 3. Different medical topics that we talk about when we're talking about jockey health, and that's really important, is talking about their training. Unfortunately, jockeys don't have a coach like like a lot of the other sports have. They don't have anybody to really guide them. All they know is just what the jockeys before them told them, and what they think is best. And so unfortunately, they're not necessarily really up with the times. They don't really have the information that they could to improve their performance, to improve their training. They still do very archaic things like wrapping themselves in cellophane and oil to try to lose weight, and it's fascinating, but also still very bizarre. One of the other problems that they face is dehydration. You have to consider vitamin D, their rapid weight loss. Some of those jockeys will lose 7 to 10 pounds in a day by getting in the hot box, or by doing other weight loss, by flipping, which is when you make yourself throw up, or diuretics are still being used in the jocks room, believe it or not, although they're not allowed in any other sport. It's kind of just like on the kind of like the down low that everybody knows that it still exists. There's a lot of, in theory, opioid dependency. Hopefully we're working on that. There is depression, particularly if they're injured, alcoholism as well. I have literally seen someone drop 7 pounds in a day, go ride their races, and come back to the jocks room and like crack a beer open when they had to ride the next day. I was like, like why put yourself through like that yo-yo weight? Are those beers really worth it? But that's something that you also can counsel. It's a ton of orthopedic injuries. To be honest with you, it's not necessarily really that much overuse injuries. It's really just from like the injuries that they've had where they had really bad falls. Jockeys, again, like I said before, are some of the toughest athletes that you'll ever take care of. There have been a couple of studies that we've been able to find that have been done, particularly the Irish Turf Club does an excellent job, and they actually have a racing school, like a jockey school that the Irish jockeys go to, and they do have a lot of support for nutrition and training and those types of things, which is really nice. And this is where this article came from. But what they're saying is just, if jockeys would work on high intensity interval training, they may actually be able to improve their aerobic and anaerobic capacity, and may actually be able to improve their performance. So one of the problems with jockeys, again, like I mentioned to you before, is that there's a lot of myths and things that they believe that are really hard to change. They're not necessarily really very open to information and that type of thing. It's really hard to kind of get to them about this type of thing. So a lot of them will just run, but a lot of them just run just to try to lose weight. And very few of them actually work out, because they say, well, I work out in the mornings and I work out when I'm racing races. And so I don't really feel like, I feel like I'm working out all the time. But actually what the studies say is that they actually don't use that much energy, or actually expend that much energy when they're doing the morning workouts. And because the race is only like a minute and a half long, the really good jockeys will work out outside of that. And like I said before, doing a high intensity interval training will be really beneficial for them, because when you're coming down that stretch, you have to have that, you have to have that endurance to continue to keep pushing. It's not a distance thing. It's really a very short spurt of activity that you're doing. Sometimes what they also do is they'll train on this thing called an equicizer. I'll show you this video. It's actually kind of like a man-driven type of I don't even know how to describe it, but they use this to train on. It helps them to maintain their stance, to work on their stance, to be able to work on pushing, to work on their speed, to work on their stamina.
16th pole.
That's Mikey Smith.
There you go. Can tell one.
So I also really like the equicizer. I use it a lot when I'm evaluating the jockeys, because if you think about it, let's say that a jockey gets like stepped on, right? But he's got a really important race the next race, and he's like, I want to race. And I was like, well, you know, can he maintain his stance in the irons? Like, can he be safe? Or is his pain so bad that he can't maintain his stance and then he could potentially not be able to hold the horse the way that he should, which would potentially put the other riders, you know, in danger for injuries if he can't control his horse. And so we'll actually put them on the equicizer, make sure that they can maintain their stance, make sure that they have good strength, and that helps to ensure that they feel safe to go onto the horses. So medical management of our colony of jockeys, that's what it's called. It's called a colony. So the first thing that we do when we first get to the track is we'll go to the jocks room, similar to like a training room, except for we don't have nearly as much equipment there. I have like a small area that's like in the back of the locker room, which I hate going to, but if we really need to evaluate somebody, we can go back there. We have our own little office that, as long as it's not like an emergency or something that they need right away, that they can come to see us in our office, which we have more space. But we'll go to the jocks room. We'll follow up for injuries from the previous week, the previous day. Even if they had an injury at another racetrack, a lot of times I have a good communication with our local racetracks. And so if they have a fall in Delaware, they'll give me a heads up. The jockey's coming to my racetrack, so I can take keep an eye on him, or you know, vice versa. Sometimes I'll call them if I have concerns about a jockey who's supposed to ride a race where they are. And you know, sometimes they also have morning incidents that happen, and so we try to make sure that we follow up with them. When we first started, they were very resistant. You know, they didn't really need any help, but once you started engaging with them and they understood why you were there, and that you're not necessarily really trying to keep them from racing, that you're just making sure that they can go back to racing safely, now they like won't leave me alone. Like they get like a stubbed toe and they want me to see them. But you know, I'm always happy to see them. Anyway, so we follow up with previous injuries. Believe it or not, the horses are actually followed by an ambulance. This is actually, I believe, the only sport that actually has that, like an ambo has to follow them. If a rider goes down during a race, then the ambo is the first one on site. I typically will either sprint there, which I have done some pretty good runs, and I have to stay in shape specifically to make sure I can get out there. Or we actually have a gator if we need to. I also have had the vet truck, because there's also vets on site. Sometimes the vet truck will come and get me and take me over to the fall if needed. We do a rapid assessment. As long as it's not emergent, we can always follow them up in our office or in the jocks room and reevaluate them. And then you really only have about 20 minutes in between races to be able to clear the jockey to go back to the next race, which is really kind of a difficult thing, because they also have to get dressed and they have to make their way back. So you have to make sure that you do a quick and thorough evaluation. If a rider were to fall, they're immediately evaluated by EMS. The sports medicine physician or you know, will kind of go and meet them there. If there is an acute evaluation for loss of consciousness or cervical spine, then we call for immediate transport. It is very important to make sure that you have a good emergency action protocol and that you're able to, you know, we actually had to train our security to make sure that if there was a rider that goes down, that they know exactly how to direct the outside ambo to where our inside ambo will be, so that way there's no confusion and there's no delay in care, because racetracks are huge, there's multiple different entrances, and a couple minutes could really make a huge difference in these types of injuries. Unfortunately, they are some really bad wrecks sometimes. I unfortunately have had a very scary fall a couple, I guess it was about almost a year ago, where the patient actually wasn't even responding to pain, was completely unconscious, was having agonal breathing, and it's sad to say, but you know, there's a lot of injuries that happen, but death happens at the racetrack, and unfortunately there was an exercise rider who actually passed away. I believe it was earlier this year, and it's just, it's just such a high risk sport. So after you have immediate evaluation, you can decide whether or not even if it's, not a life-threatening emergency, do they still need to go to the hospital? Are they having abdominal pain? Do they need to have any type of scan done? Was there a loss of consciousness? And if it is, then you would have them go to the hospital. You want to try to make sure that they get to the right kind of hospital. We'll talk about that in a second. I will go back to the trailer. The nice thing about the racetrack is there's always films, so I can go back to the trailer and I can review the film and I can call the hospital and let them know, okay, well, they landed on this way, or I have concerns about this. You don't want to just say, oh, well, the jockey fell off of a horse. You want to say the jockey fell off of a horse going 40 miles an hour and hit his head or lost his helmet. Any of those types of things that are actually very important information, so that way they take it seriously, because this type of trauma is much different than a lot of other sports injuries. You can also discuss previous medical history. A lot of these guys have already had multiple fractures, so if they're having pain in their back and I already know that they had a previous T6 to T7 fracture, that's important information then for them to know in case they see it on the x-ray and they're not sure if that's acute or chronic. If they don't need emergent transportation, you can allow the jockey to kind of clean up. You can assess in a quiet space. And then the most important thing also is to notify everybody, because someone needs to ride a horse. And so if it's not going to be this jockey, they need to find somebody else, and they need to find them fast. There really is like no room to change, because of the telecast. People are expecting these races to go off at a certain time. So delay of racing is really like very frowned upon. And there's like, you just can't do it. But you do have to notify people if they're not able to ride, that this jockey is not fit to ride, of course, while maintaining, HIPAA. Jockey injury in the United States. This was an article which was published, again, one of the only jockey articles out there, but nearly 1 in 5 of the jockey's injuries are actually to the jockey's head or neck. There is some information about concussions that we'll talk about later. But again, the head is very susceptible to injuries. The other one that we find a lot is shoulders, because of the way that they fall on it, whether it be a clavicle fracture. I actually met a guy who was a jockey who fractured his clavicle 13 times between the two of them. But that is just like unreal. This is from Michael Turner, who was one of my very, very good friends and one of my mentors that has really helped me. He kind of was the medical director of the British Horse Racing Authority a while ago, and kind of really led the way in jockey medicine and jockey healthcare. So this was one of his studies, and they had mentioned that concussions really only account for about 2.8% of the total falls, and 11.6 out of 100,000. 11.6 out of 100,000 rides. And so you think about how, there are multiple rides in a day, because you have about 15, you can have anywhere between 4 to 15 jockeys. You could even have, I've seen a race with 2 jockeys in a race, but you can have anywhere from 2 to up to like 20 horses in a race, and you can have anywhere between like 10 to 12, sometimes even 15 races in a day. So that's per rides. This was actually an article that we published, which talked about where we had published our data. This was over the past couple years. It was difficult to put together, but we thought that it was necessary. Most of the injuries that happen are really like soft tissue or just like contusions. We had noticed that 4 of our injuries actually were concussions, and that there were 4.5 injuries per 1,000 mounts. So this isn't necessarily always time lost, which is kind of one way that you could look at, jockey injuries, is how much time was lost, how much money was workers' comp. So that's the majority of the studies that we have out there. Our study was unique because anytime that there was like an incident where there was like a potential for an injury, we actually documented it, because so many times when you have that type of accident, like their whole body hurts. that you can't really tell exactly, you know, what the injury was, and it kind of just presents itself maybe a little bit later on. So you might not necessarily, you know, the specific injury, because their whole body hurts, you might not necessarily know exactly what the injury is at that time, but it's important because they always come back. Like I said, they're tough as nails, so a lot of them will just ride with this pain or this injury. They're kind of like almost used to it. It's not a matter of like if you fall, it's like when you fall and how bad. So you know, we actually kept track of all of the incidents as opposed to just injury. But yeah, there was a lot of contusions and things like that. I kind of like to warn people. I'm excited to hear when people start working at the racetrack, but I also like to warn them about, you know, there's a lot of times that you're not going to be doing pretty much anything, but when you do stuff, it's very fast and it can be very bad. So you just have to like always be prepared. I feel like that's how we are in sports medicine, though. We kind of just like walk around like, what's the worst case scenario that could happen here, and just make sure to prepare for that. So again, here's just some more of our injury data. You can see that out of those incidents, we had about 20 transfers to the hospital. This other medical facility was like getting x-rays somewhere else. So falls resulting in injury was 76.3%. Here's a couple. You can see how many hematomas, contusions, and bruises were documented. There's a lot of sprains and strains. Believe it or not, we've actually had an ACL tear in 2 different occasions from jockey injuries, which was interesting to kind of consider. You know, like how long do you have to wait till they get back, because they're not really doing lateral movements, and it's just very unique in thinking about how to get, you know, how to return to ride, whether it's an orthopedic injury or a concussion. But here there's also a lot of dental injuries that we've had, and believe it or not, you could consider, you know, why aren't these jockeys wearing mouth guards, right? That would be a great idea in case they fall and they chip their tooth or whatever. But because the jockeys are actually yelling at each other while they're on the horses, they are against wearing mouth guards, and they're also very resistant to pretty much anything. Although if you could convince jockeys to wear mouth guards, I do think that that would be beneficial. The other part about our study was exactly how do jockeys get hurt. So you can get thrown from a horse. The horse can actually spook or can rear up. The horse, unfortunately, can sometimes break down or can break a leg, and that's when the horse like actually collapses. They can actually collapse from heat stroke as well, which has been something that we've had to keep an eye on. So you think about heat stroke in humans, but heat stroke in horses are also occurs. So they actually have they have a truck that has water on it in case there's a horse that goes down, you can water it down. We've been hosing the horses down a lot. We have ice. They actually have like an ice vest for them that they can put on them if they're really hot. But those are things that you have to look out for. Sometimes the horse will just trip or stumble. Sometimes they'll clip heels, like I said, like their legs get tangled. Sometimes you can actually get head butted by the horse, which has resulted in one of the worst concussions I've ever seen by a jockey. Pulling up the horse, you can actually get some bicep tenderness. You can have some other injuries. And then there's also equipment failure, your irons coming off, the saddle coming off, being struck by an object. I've had people who got hit in the face by a horseshoe from a horse in front of them. You name it, it can happen at the racetrack. Here's also where the most injuries are like based off of location are. The home stretch is one of the most riskiest areas. You know, it's the end of the race. People are really going for it. They're really pushing. So they're at the highest speed at this area. So this is when a lot of the really bad falls happen. The other areas of concern is, if you can see, prior to getting into the gate, when the horses are just kind of like waiting to get in, there's a lot of horses. The horses can get very rambunctious. They can get a little bit spooked because there's a lot of people around. So that is a risk of injury. Entering into the gate can be difficult. In the gate can be difficult, and then actually leaving the gate. So this whole gate process actually accounts for a large majority of the injuries that happen. And so they are working on different types of gates, like more open gates, so that way the horses don't get as scared or as spooked. Or if the horse kind of like rears up, a lot of times the gate will actually open, so that way the horse doesn't hurt themselves and it's not too much resistance for them. But again, still a lot of work that could potentially be done, you know, making sure that you have one of the more padded gates because they're mostly metal, which also is a thing if you think about it from a weather standpoint. But you know, when there's lightning, sometimes some of the racetracks don't even have lightning protocols, believe it or not, which is another thing that athletic trainers certainly could contribute Here's one of my jockeys who, believe it or not, had fractured like 27 bones by his 27th birthday or something like that. But this is a picture of all of his different injuries. I actually have this on my wall. So the injured jocks, like I said before, if you think about it from a trauma standpoint, believe it or not, all of these jockeys qualify based off of this category Charlie for significant trauma, and you could argue that they all should be going to trauma centers just based off of their speed. So if you think about it, if you have a motorcycle crash that's greater than 20 miles per hour, they should go to a trauma center because of the speed. Well, horses are going 40 miles an hour and can get trampled. So I think that there's also like a trample in here somewhere. Although technically, unfortunately, EMS doesn't always follow that, which can be very frustrating, and has kind of been like one of my, things that I've been working on in life to try to correct. Oh, okay, sorry. One of the most common sports-related traumatic brain injuries actually is from equestrian incidents. You can see how very large this horse is and how very small this jockey is. Oh, I don't know what happened there, sorry. There are some programs also, besides, I personally just work, at the racetrack. That's just my job. But a lot of these things that we've talked about today can also, be adapted to our other equestrian riders, like our children, the importance of helmet safety. So, and protective equipment. They wear these vests that try to help to protect from rib fractures and those types of things. Although people still fracture ribs, they have these helmets. They're not there to protect from concussions. They're literally there to protect you from getting your skull crushed by a horse. And if you think about it, it's difficult because they have to evaluate these helmets based off of how they hit the ground, how they hit the dirt, how they hit the rail, if something steps on them, and then also the goggles and boots. The goggles, they actually wear multiple pairs. So as they're racing, they'll actually pull down a pair if they have too much dirt in their eyes. Let's see. So again, just overall, helmets are important. A good fitting helmet is really important. Head injuries are more responsible than 60% of horse-related deaths, and that actually really does happen, like I showed you that before. This is one of the ways that they actually do helmet testing. I felt that this was really interesting when I learned more. I actually went to an entire conference about helmets, and you take helmets for granted, but this is actually how they test them, by dropping them. But again, it's not really recreating it as it would be specifically on the racetrack, because you can't really do it in a perfect scenario. You don't really get that rotational change to really test it to see how good these helmets are for the jockeys. A couple different things are physiologic attributes of jockeys predictors of fall. So, lower anaerobic and aerobic fitness were associated with greater risks of fall. So you want them to be in good shape. Where the iron is where your foot is in the irons can also contribute. And also newer riders should not be with newer horses because the newer horses are a little bit rambunctious. The newer riders have a little less experience. But unfortunately, when you're just starting riding, beggars can't be choosers. And that's one of the concerns with these young riders, is that they just kind of like get the bottom of the barrel type of horses, and they're just learning, so they don't really have the luxury of having the really nice horses. When you're really good, you get the really good horses. You have to continue to maintain a low body mass. Like I talked about before, flat racing is really only like 1 to 3 minutes, and most of it is actually your max heart rate, so you want to train that way. One of the other problems that we talk about with jockeys are concussions. Believe it or not, up until like a couple years ago, jockeys would fall off of a horse going 40 miles an hour, would wake up, be a little bit dizzy, and was allowed to continue to ride the next day. If you think about, what kind of, problems that concussions have is, you can have some, you have difficulty because you have a slowed reaction time, you have difficulty with your depth perception, your balance is off. So all of these things will make riding a horse very dangerous. So our racetrack was actually, I believe, the first racetrack to really implement a sound and robust concussion protocol. that was in Maryland. And to be honest with you, we just were like doing what we thought was necessary. We had no idea what we were doing was so revolutionary in the sport of horse racing, because every other sport has concussion protocols. So to us, it was just like second nature. This wasn't anything new for us. And everyone's like, oh my gosh, you're doing concussion protocols. You're talking about concussions, and we don't have concussion and I was like this is not rocket science, guys. Like this is how Pee-wee football gets taken care of, right? So if Pee-wee football can get taken care of like that, how come professional jockeys aren't getting that type of attention or follow-up or anything? One of the problems with the difficulty with diagnosis, obviously, is you have a very limited amount of time when you're at the racetrack. There's a huge adrenaline rush. So when you first evaluate a concussion, sometimes they kind of like wave you off or don't really want to get evaluated, and they're like, oh, I'm fine, I'm fine, I'm fine. We actually had a jockey who had a fall, and EMS evaluated them, and he went back to the room, and apparently he was very tired, and so he went to go lay down. Nobody knew where he was. They finally found him. He was confused. He didn't know where he was. He didn't know what his name was. He didn't know what his birth date was. And so then they did eventually take him back. They did eventually take him to the hospital, but that almost went missed. We ended up following up with him in our clinic for concussion because he was one of our riders. But really dangerous stuff, and it is a very high pressure situation. I mean, who knows? What if you fall right before the Preakness, which is like $1 million race? Or what happens if you lose your chance at the Kentucky Derby, right? You're not going to tell. You're not really going to want to fess up to your symptoms. Remember that there are many areas of concussions, and this is something, the thing that we've been trying to work on in Maryland is, making sure to educate the jockeys about it, because a lot of this was like nobody ever told them. I've had so many jockeys that are retired that have said, oh, I remember falling, and then, my ears were ringing and I still rode the next race, or I don't even remember what happened the rest of that day, but I know I rode. My wife said I did a good job. And so those stories just completely boggle my mind, and just really scare me that these things happen, and that we could potentially miss it, because again, one bad step, and I mean, you could be talking about a life-threatening injury. So you want to talk about evaluation of a concussion. Do you have people who are proficient in this at the track, which is most of the time no. How do you manage it? What about how do you get a jockey back onto the horse, right? So in all of our other sports, we have return to play, where you have them dribble first, and then first you have them do light aerobic activity, and then you kind of do some do some movements in there, and then you might have them dribble a little bit or do some non-contact drills. Well, how do you do that for a jockey without putting them on a horse, which is very dangerous, and we'll talk about that in a few minutes. Prevention, how do we prevent concussions? How do we protect them? How do we regulate it? And do we need baseline concussion testing? Let's see if this loads.
What we want to do is get back out there. We don't want to disappoint, the owners and trainers that have allowed us to ride their horses in the afternoon. I mean, they want us to be at their best, so we want to give them our best. A race last year, my horse took a bad step. I ended up falling off mid-race. A spill there. Out unconscious for a few seconds, and woke up, got treated on the racetrack, and then next thing you know, I'm in the ambulance. Something is not right. I feel like my timing is a little bit off. I feel like I'm a little bit slower to respond. And I think that's, when you're out there, the adrenaline is out there, is in your body. And all you want to do is race and compete, but not until something like that happens, where you have no choice but to sit out a few races and get yourself together, do you realize that maybe you're not, thinking as quickly as you should be.
Here comes recoil 9.
So what we want to do is get back out there. We don't want to disappoint, the owners and trainers that have allowed us to ride their horses in the afternoon. I mean, they want us to be at their best, so we want to give them our best.
Sorry. So back to, oh no, I did the wrong thing. Hold on. So anyways, concussion management is really important. Having a concussion protocol is extremely important. I'll show you the return to ride that we did, which is, oh, sorry, it's being wonky. this is our education, where you actually can educate jockeys about the, you know, the negative effects of concussion and what a concussion is and what you might feel like. We have them sign that. Remember that when you have a concussion, that it can affect your vestibular and ocular you can have vestibular and ocular symptoms, which obviously affects your ability to follow horses, to maintain your stance, to make good decisions. And so you can also retrain jockeys just like you retrain other athletes, you know, to work on their balance and to work on their ocular movements and things like that. When you're talking about a return to ride protocol, you know, you do want to try to get some type of heart rate incorporated. So you might have them do some running or jogging, and then you might want to do some sport specific exercise, which is like, you know, being able to do a lot of squats and doing some burpees, and trying to recreate what you do on the horse, but actually like on a bosuba, which gives you some nice balance training. And then non-contact drills. So what we do is, remember that equisizer that I showed you, we'll actually put them on the equisizer and have them go through their motions and get their heart rate up to make sure that when we exert them that they're not having symptoms. And then the final step is having them go back to light, like a sound horse. Believe it or not, sometimes they'll give horses almost like Benadryl to kind of like calm them a little bit, and that's a way that they help to train the horse. So sometimes we'll recommend that they get on like a nicer horse to begin with, and then if they're feeling okay, then they could start galloping and breezing, which is you know, which is faster. So in a perfect sports medicine world, we would have concussion protocols across the country. There will be a universal governing body. That's one of the biggest problems with the horse racing industry, is that we don't really have anybody who's like overseeing all of this from a medical standpoint. Unfortunately, most of the recommendations come from non-medical people, which is very frustrating for someone who actually is very proficient in medical protocols such as that. So medical directors really should be working together. I have made a lot of really great friends around the country, and we kind of have our own little pact that we work together in our group. Research really needs to be improved. We need to have better nutrition management for the jockeys. We need to work on improving their training. We need to increase the weight of scales. We need them to, you know, follow WADA guidelines like everyone else, so not having diuretics. There should be model rules for trauma management. There should be universal weather protocols, so when there's lightning out there and they're all put in that metal gate, that they're not at risk for getting, you know, struck by lightning. Mouth guards consider, and then also a helmet replacement program. One of the most important things I can't believe I almost forgot about this. If you have an equestrian rider who has a fall and hits their head, they need to get rid of their helmet. It's one and done. It loses its integrity. It's one of the most important things that you can counsel your athletes on, is if they have a fall and they're equestrian, they need a new helmet. You know, is there concern for risk for CTE with multiple head injuries? Well, certainly there could be. Racing has taken me kind of like all over the world. I've been able to speak in Dubai. I've been able to go and work with the medical director at the Irish Turf Club. I've gone to Kentucky on multiple occasions. That's me on the equisizer, which I'm not very good. Believe it or not, another totally random thing is that I actually ended up resuscitating a person. We ended up implementing having AEDs at the racetrack, and a couple months after we did that, there was a person who had a heart attack in the paddock. He was one of the grooms. We were able to resuscitate him and defibrillate him within 2.5 minutes of collapse, and he walked to the AMBO, which is pretty cool. So any questions? Sorry, that was a lot of information.
Hello, that was fantastic. Yes, I have a couple questions. Thank you, Dr. Ryan. So one question that I thought of when you were talking about all this with athletic trainers, you know, potentially, you know, coming out and doing like kind of by your side and what have you. If there are athletic trainers that were interested in shadowing and kind of seeing what's going on, how would you advise them to go about it, since it's such a different world?
So you would really have to find, like, if you know that there's like a local racetrack like in your area, you'd have to figure out like if there is any medical personnel that works there, and maybe try to get in contact with them. Okay. Why would athletic trainers be useful in, you know, at the racetrack? Because they do have a lot of aches and pains, and they do have a lot of soreness. You know, they like maintain the stance like this, you know, and they're like, it's so much cervical stuff, it's so much upper back stuff, it's so much leg stuff, you know, they would definitely benefit from some physical therapy and, you know, rehab and things like that. And there's so much that athletic trainers, I think, could teach jockeys to make them better at what they do and make their lives a little bit better.
Okay, awesome. And then one other question. So, you know, a lot of the athletic trainers are used to doing baseline concussive testing, depending what the sport is. Do you do that for the jockeys?
So yes, and I'll tell you why. There has been literature out, you know, like I believe it's the CARE consortium that just was like published a couple months ago, that actually a lot of it is coming out saying, you know, should we really be having baseline concussion testing, and is SCAT-5 really the, you know, what is the best baseline concussion testing? And, you know, it can vary from, you know, from test to test, even if you don't have any injuries, and we know that. So how useful is a SCAT-5? Well, if you are good at doing concussion evaluations, you really don't need a baseline, to be perfectly honest with you. And I agree with that. I don't think that if you're good at doing concussion evals, particularly with the VOMs coming out recently, like I feel like that's so important that you don't need baseline concussion testing, to be perfectly honest with you. But at the racetrack, the reason that it's important is because there's so many people that don't know about concussions there, that it's nice to have something to at least compare to. Believe it or not, it's not about the numbers, but some jockeys can't even maintain their balance like on one leg, which is fascinating because they're in the irons all the time, right? Or some of them can't say their months backwards. Some of them are terrible with numbers. So it's just like, can this person do it? Can they not do it? You know, the other reason that I like to do baseline SCAT-5s is because I think it's an excellent opportunity to educate your patient one-on-one. If you have a concussion, this might happen. This is what we're going to do. And it's actually kind of funny now because my jockeys are so used to doing it that it's almost kind of like a game now. My one jockey will be like, would recite the words like from the year before. And he's like, so do I have to still do it? And I'm like, yes, you still have to do it. Just do it. And so when they have a fall, they know I'm coming for them. They get in their stance, you know, they put their leg up, you know, they're ready. They're like, I'm ready. Yeah. And so I'm like, you know what? That's a well-trained jockey. So, you know, they know it's coming. It's just, you know, it's part of our practice now. And, you know, so I find that the baseline concussion testing is useful for that.
Awesome. And then I have another question here.
Also, what happens if like I have to take a jockey off before like $1 million race? Like when you're talking about that kind of money, right? Like, I need something to back me up.
True. You need some baseline. That's absolutely true. All right. So I have another question here. What is your approach to a jockey asking for electrolyte solutions? Presumably they are using a diuretic but don't want to confess this information.
Okay, so I literally walked into a jockey room one time and they're like, hey, doc, you got any potassium pills? And I'm like, oh, gosh, what would you need potassium pills for? I'm a doctor. I know what you're doing. But there are a lot of reasons that you can need electrolyte replacements, right? These guys are out there like in 90-degree weather, riding horses. They're going in the hot box. When it is really hot, we actually will change, like we try to like increase the weight a little bit so we can encourage them to drink fluids. I do recommend electrolyte replacements for them. I think liquid IV is an excellent, you know, replacement for them. I try to ask them, you know, like, are you using a diuretic? And to be honest, most of mine aren't. But with that like rapid shift in weight, they do need like electrolyte replacements pretty frequently. You have to be careful about that though, because think about what electrolytes do, right? If you give them too much sodium, they retain fluid, and then you screw it up for them for the next day, and then they have a harder time because now they're bloated with fluid and they have 5 extra pounds on. Yeah. What happens is when they race, they actually get reweighed after they finish. So if their weight is up, then they could potentially lose that race.
Interesting. I have someone that calling you out, giving you some props. He said, speaking from the Norton Healthcare Sports Health Team in Lowville, did I say it right? Lowville. Dr. Ryan is a wealth of information for our team. one of the hardest parts of all this is the bilingual component that is very typical in this setting. How have you overcome that?
Oh, thank you. Hey, what's up, Norton Hill? I'm so excited to have racetrack friends. So I am very fortunate that I actually have a my secretary, the person that is like my clinic director, is a translator.
Oh, that's awesome.
So that has made it very easy. We do translate most of our documents that we do. Well, you know, like if we have a physical questionnaire, which that's what we developed, a physical questionnaire. We developed, you know, a protocol or whatever. Once any resources, by all means reach out to me, but we also made them all in Spanish as well. It is difficult. It is a different, you know, it's not even just difficult because of language barrier. It's also just a cultural thing. Like there's so many cultural things that you take for granted. But I also have like worked with my jockeys to try to like learn more Spanish. The problem is that they all have different like they have different you know, like dialects like that, you know, like the Puerto Rican jockeys speak a little bit different than like the ones from Guatemala. And so I've tried to like get them to help me to learn Spanish, but they all speak in slang.
Yeah, that makes it difficult.
This isn't working. I do use Google Translate the best that I can, but I still use our language line if I need to. You just do the best you can.
Okay. That's all the questions that I have. Dr. Ryan, thank you so much. I see that all the attendees are still on, so I know that there's a wealth of information. You just have so much knowledge. So, and if anyone is up in the Maryland area and, you know.
You can come to the racetrack with me. I'll take you.
Yes, I have done it. It's fascinating. The horses are beautiful and it's a fascinating.
They're so evil.
She's afraid of them, but yeah. All right, I'm just gonna change over just to show you one last slide and then get you guys all out of here, okay?
Are those the questions? I try to make the questions easy.
Those are, yes, those are. I'm showing my screen. Hold on. Okay, so just lastly, again, you guys will all receive an email one after the webinar concludes, which includes a link to the combined quiz, which Dr. Ryan was just talking about, evaluation and assessment. So good luck with that. You will have 72 hours to complete in order to receive CATA Live CEU. Contact us with questions at journalclub@relevesportsmedicine.com. Our next Journal Club webinar will be September 20th from 6 to 7 p.m. Eastern Standard Time with Dr. Jason Brucker. He's a sports medicine physician and board certified rheumatologist. And for more opportunities to obtain live CEU through the VOC, sorry, let me pop this back out, go to our website right on here. And again, we are hiring. So if there's no other questions, thank you everyone for attending, and I am going to end the broadcast.